missed out on Dr. Vishal Nandeshwar.
Good evening everyone. Myself Dr. Vishal Prakash Nandeshwar, presenting on the topic an observational study of prevalence of dry eye in newly diagnosed untreated depression patients. Introduction: dry eye disease is a common multifactorial problem with a varying prevalence rate of 5 to 34%. Numerous exposures including medication use, hormonal changes, environmental exposures and neural alterations are involved in the pathogenesis of dry eye. Common symptoms of dry eye patients include pain, irritation, itching, burning and grittiness. Dry eye syndrome involves multiple risk factors that, when disregarded, can result in a treatment failure and frustration both for the patients and the physician. It poses a huge economic burden to patients if not evaluated for risk factors that may result in delay in treatment. It affects the quality of life of patients with regard to daily visual acuity. It results in a social stigma as a patient may have chronic red eye. Patient may go in for depression. Like dry eye, depression is also chronic disorder nowadays. Both affect the quality of life. Many studies have been reported that an association between the dry eye and depression, both post-traumatic stress disorder and anxiety and dry eye. Previous studies report the prevalence of dry eye disease in depression is 29%. Aim and objectives of my study was, has been undertaken to determine the prevalence of dry eye disease in newly diagnosed depression patients without any previous medications. Material and method: study design. It was cross-sectional observational study on the sample size of 100 patients who were newly diagnosed depressive disorder patients from Psychiatry Department of Ispat General Hospital, Rourkela, Odisha. Study center was Department of Ophthalmology and Department of Psychiatry, Ispat General Hospital, Rourkela, and study period was 6 months. I have included the patients of age more than 18 and less than 17 years old and newly diagnosed depressive disorder patients without any previous medications. And age less than 18 years and more than 70 years, in depressive disorder patients on drugs, ocular infection, inflammation patients, taking antihypertensive, antihistaminic, anti-tussives, anti-androgens, topical eye drops, contact lens wearers, previous history of ocular surgeries, history of autoimmune disorders and pregnancy, thyroid disorders and lead anomalies were excluded from the study. Methodology: newly diagnosed depression disorder patient with no history of medication got selected with proper written informed consent from Psychiatry Department. All patients were diagnosed and classified as a mild, moderate, severe depressive disorder on the basis of ICD-10 classification for depressive disorder by the psychiatrist. On the same day, all patients undergoes a complete ocular examination and dry eye tests. Dry eye is said to be present if minimum 2 tests were positive. Since there was no significant difference between the right and left side tests, I took right eye as values for statistical purposes. The information collected regarding all the selected cases were recorded in a master chart. Data analysis was done with the help of the Spaces software, and the p-value was calculated. The p-value less than 0.05 is taken to denote the significant relationship. My results: age distribution of the studied 100 population, 20% were less than the 30 years of age, 27% patient between the 31 to 40 years, 31% between the 41 to 50 years, 22% persons at more than 15 years of age. This is the graphical representation of the age distribution. Age versus dry eye. Of the 100 studied population, only 4 patients had dry eye in less than 30 years of age group, 10 had dry eye in 31 to 40 years of age group, 14 developed dry eye in 41 to 50 years of age group, 14 showed dry eye in more than 50 years of age group. This is the graphical presentation of dry eye versus age. Sex distribution: among the 100 studied population, 45% were males and 55% were females. Blink rate distribution: of the 100 studied population, 40% had normal blink rate, 30% had grade 2, that is 75% of normal blink rate, 22% had grade 3, 8% patients had grade 4, 25% of normal blink rate. Tear film breakup time distribution: of the 100 population, 60% had normal TBUT, more than 10 seconds, 27 had 6 to 10 seconds, 12 had 2 to 5 seconds, and only 1% showed less than 2 seconds of tear breakup time. Schirmer score distribution: of 100 studied population, 62 patients had normal Schirmer score, 30 had 6 to 10 mm, 7 patients had 2 to 5 mm, and 1 patient had less than 2 mm score. This is the tear film meniscus height: 63% less than 0.3 mm, and 37 patients shows less than 0.3 mm. Severity of depression versus dry eye: of the 100 studied population, 38 patients belongs to mild depression group, 35 belongs to moderate depression, 27 had severe depression. In that 38 patients, 5 patients had dry eye. In 35 patients, 17 had dry eye, and in 27 patient, 20 had dry eye. This is the graphical representation of the severity of depression versus the dry eye. This is the prevalence of dry eye. Among 100 studied population, 42% had dry eye, 58% did not have dry eye. The prevalence of dry eye disease in by patients of depression is 42% in my study. Discussion: if dry is not evaluated for risk factors, it leads to an economic burden to the patients. Many studies have shown the relationship between the depression disorder without any medication, that is prevalence of dry eye in the depressive patients. In our study, the prevalence of dry eye disease is 42%, which correlates with the literature of Nande et al. 1992. In our studied 42 patients among 100 studied population developed dry eye disease. It shows that dry eye disease will occur in even newly diagnosed depression patients also, and not the antidepressant alone can cause the dry eye. Conclusion: so from this study, it is clearly seen that antidepressant itself causing dry eye disease, not only the antidepressant which are using for treating the depression. If we do not diagnose the dry eye early and not treat it properly, then may go for serious complications like corneal melting, perforation, and eventually vision loss. So it is very important that psychiatrists take this into account, especially while prescribing antidepressants, which also aggravates dry eye disease, and send the patient for ocular screening for dry eye disease once they diagnose the depression, to avoid such complication and to provide patients quality of life. These are my references. Thank you.
So all these patients, what did you treat them with?
Yes, sir.
Was there a difference in the treatment for the psychiatric treatment? Was the drug changed if they were diagnosed as a dry eye?
No, sir. If they are diagnosed with a dry eye, then we used to say to psychiatrists that they can go for a very mild treatment of depression, because already if they have...
There can't be a mild treatment or a moderate treatment. There are different drugs available. So were the drugs changed for the treatment of depression? Did you ask them? Did you find out what they did eventually? If you have diagnosed the patient as a dry eye,
Yes.
is their treatment going to change?
So I have not asked.
And after the treatment, did the dry eye improve?
Those patients who came to me, their symptomatic relief, sir. Symptomatic relief I have found.
You have not checked the other criteria that you were
Yes.
used for diagnosing. Were there different types of depression that you went into? You have taken a generalized depressive disorders.
Sir.
There are different types of depressions. So
Sir, I have
was it
taken,
different in
I have
different?
taken the depression for more than at least 2 weeks, depression.
No. I'm talking of different thing. In depression, there are sub-diagnoses.
Yes, sir.
So did you check for those?
No, sir, not other.
Like bipolar disorders,
No, sir.
those kind of?
Only depression.
Okay, fine. Thank you.
Thank you, sir.
Yeah, sure. Yeah, sure. Why depression should cause dry eye? Because of that. It decreases the quality of your life.
Whose screen time is more, they come to me for complaint of dizziness in eye and all those problems related to dry eyes. So I tell them to reduce the screen time. That is the best treatment.
Yes.
And I prefer to give some lubricant in the form of ointments, like MCM ointment, which is carboxymethyl cellulose with glycerin. Ointment is more effective than liquids. So I have not seen any patient who has gone into depression. I am working there for last 17 years, and dry eye is a common symptom there. So no patient has gone into depression.
So he's talking of a different thing. He's talking about diagnosed depressed patients having dry eyes. That's his paper. It's not about dry eyes causing depression.
Yes.
Yes, depressive medicine can cause dryness.
No, without treatment. So his point of contention is, if there is a patient who has depression, he is postulating that because of the serotonin receptors on the ocular surface, the depression itself can cause changes on the ocular surface, which will cause some amount of dry eye. So it's a pathological dry eye. What you're describing with relation to the screen and the students is more of an evaporative dry eye because of less blinking. So it's a computer vision syndrome. So it's a reversible thing.
Yes.
Yeah. Thank you.
Thank you, sir.